Hey there, everyone. It's Hope. I'm here today. I'm talking to Jim. We're at Gateway. It's a new counseling center for mental health and for substance abuse. And so we just wanted to talk a little bit about how you can get help if you're having a little bit of trouble. So Jim,
Yes.
tell us about yourself. Let me know, what's your name? What do you do?
Sure.
How long have you been in this business?
My name is Jim Scarpace. I'm the Chief Clinical Officer for Gateway Foundation, so I oversee our programs in both our community and our corrections divisions. I've been with Gateway collectively about 15 years and been in the field for going on 30 now.
Wow, that's great. That's a lot of experience.
Well, thank you.
Yeah. So, how do you think? Let's go to this. So, what motivated you to get into this field?
I think a few different things. The most important one, although it sounds kind of cliche, is to help people. I think, both growing up and then, in my work life as well, just seeing people struggle with mental health and substance use disorder. I started my career working with kids and adolescents with trauma, and seeing a lot of those kids and adolescents as they started to get older use substances to self-medicate some of those issues, and just a desire to kind of help those individuals not only find recovery but identify things that are important to them that they can focus on and really help to build themselves in a different direction.
Yeah, it's so important. So many people self-medicate when they have mental illnesses, and then it drives them down to a substance abuse problem. And yeah, so it's so important that we get people help for this.
Yeah.
So if you were a viewer, how do you think a viewer would know that, hey, maybe I have a little bit of a mental health problem, or maybe I'm kind of got a substance abuse problem? How would someone know that? What are some things you think they should look for?
Well, I think there's some warning signs that everyone should pay attention to. What I want to start with, though, is letting people know that there's hope.
Yes.
No matter how difficult things might be right now or how hopeless it may feel, we know that both mental health and substance use are treatable conditions.
Treatable conditions. We need to normalize this, people.
Yes.
It's normal to have these problems.
Treatable medical conditions. These are not moral failings. These are not character flaws. These are not weaknesses. At Gateway Foundation, we've been doing this for 55 years, and we've seen thousands upon thousands of people achieve their recovery goals. So help and treatment and hope is a big part of our message. I think for someone who's out there or a family member who might be worried about a loved one, I think if you start to see concerns like depression or anxiety start to worsen, for example, on the mental health side, where it's harder to kind of break some of those cycles on your own, where it starts to interfere with your personal life or professional life or your relationships, or you start to experience medical consequences as a result of some of those depressive symptoms or anxiety symptoms, difficulty sleeping, difficult time eating, that's a good sign to reach out and try to get assistance. And on the substance use side, the same thing. I think the biggest thing we see is individuals who engage in alcohol or other substances struggle with stopping on their own, needing to use more of the substance to achieve the same desired result, having difficulty despite negative consequences, stopping the use of those substances. If any of those things ring true for you, I would encourage you to reach out to us, because we have programs across the state of Illinois that can help you achieve recovery. We work closely with our medical team, which includes doctors and nurses, as well as licensed therapists and counselors that can help you develop a recovery plan that's best for you.
Yeah, and then if you're struggling right now, if you're acutely struggling right now, maybe you're feeling suicidal or other kinds of thoughts, you can always dial 988. That's a new service that's available. And it's just, if you're struggling, call 988, because it's really a great service, I think.
Yeah, another thing I would add is we have a 24-hour call center at Gateway.
Great.
So someone could call any day, anytime, even to ask questions and try to understand a little bit more about what we offer and what programs we have that will work for you. We have different specialized programs across the state, and we will find one that works for you. Our phone number is 877-505-4673 or 877-505-HOPE. You can also take a look at our website, gatewayfoundation.org, and it'll provide you a ton of resources in terms of what our programs offer, what services are available to you, and how to access those services.
Yeah, that's great. That's great. Thank you. And then, so when you're talking about locations and services, so in Bloomington, this new place that's opening up, it's not an in-house facility, right? It's more of an out-treatment type facility. Is that right?
So yeah, we're really excited about the Bloomington open house today and ribbon cutting. We're going to be providing outpatient services here, so that means you can come to get support and treatment and still manage your work life or your school life or your personal life. You'll have access to doctors to assess both for medications and treatment needs, as well as counselors. And that is true whether you have standalone mental health issues like depression or anxiety, as well as what we call co-occurring issues, which might be mental health issues in addition to a substance use disorder. So we really offer a whole continuum of services here. So, you know, if you have, if you live close in the area and you have questions, please reach out. I'm sure we can get some services in place to help you.
And what was that number again, that phone number?
877-505-HOPE
Okay.
or 877-505-4673.
Okay, and then the other facilities around the state that you have, I know there's one coming in Peoria, is that correct?
Yep, we'll be opening an outpatient program in Peoria, but in addition to the outpatient programs that we have throughout the state of Illinois, we also have residential programs. Because some people need some time to get away from the community and get some help specifically around their substance use and mental health issues. So we have specialized programs across the state for things like alcohol use disorder, co-occurring disorders, trauma. We have a women's program out in Carbondale. So really, you know, regardless of who you are or what your concerns are, we have programs across the state that can meet your needs. So, you know, please reach out and call us.
Yeah, that's wonderful, that's wonderful. So thank you so much for watching our video. Thank you so much
Thank
for
you.
being here today and
Yes.
for, you know, sharing the information with the people that might be viewing this video. It's really helpful.
I'm happy to help.
And-
Thanks for having me.
Yeah, of course. And if you're feeling like you're having any kinds of issues, it's really important for you to reach out and get some help, okay? You know, like I do dry January every year. I don't really drink a lot, but still I do dry January because it's like a way that you prove to yourself, hey, I don't need this in my life. And it just kind of is a nice reset. So thank you again, and thank you so much for watching the video.
Thank you.